Hey guys, Dr. Tim here, and I have the lab set up, my little makeshift lab, as an experiment today to show you how the discs between the bones in your back actually function and work. So one of the things that I have here is I have a sponge, because this sponge is a great representation of the shock absorbing nature of the discs in between the backs. Okay, so each step that you take, these are going to squish and shock absorb for you, right? So the outer part of this disc in a real disc is made up of the annulus fibrosus. The inner part is the nucleus pulposus. It's kind of like a jelly donut. The inside's a little softer than the outside. But this is a normal functioning disc. Now, when the outside thins and the inside squirts out of it, that's known as a bulge or a herniation. And there's a bunch of different classifications of these types of injuries, but this model here will show you the red part is the disc, and then these parts are the bones above and below that same disc. So if you compress this after an injury, if you look right back into this section of the disc, it's going to bulge out or herniate. From the side, it looks like this. When I'm squishing, it's popping that out like a balloon. Well, right in this area is where the nerve sits. So when that herniates backwards towards that nerve, it could make the pinch or the radiation of pain go down the leg or down the arms if it's your upper body that's involved. So my experiment today is going to be just showing you these sponges and the difference. I have a really thin, dried out one. A lot of people say I've got thinning of my disc. Well, this represents thinning of the disc. The reason why this sponge is so thin is it doesn't have the flow going through it of water in the case of a sponge, but in the case of our discs, it's because of lack of blood flow. So I'm going to show you what happens to this disc when it's real thin and dehydrated compared to the one that's functioning normally with squishiness. And so I've got a cup of water and I'm going to rehydrate this disc. So as we start to hydrate the disc, you'll see that it comes to life. It's absorbing all of that water. So when we're done, we actually have a fully hydrated disc. And that's what decompression therapy can do. It can pull those bones away from one another to increase the space there so that the blood flow can go in and penetrate and rehydrate the discs. So I hope you learned something here with our little experiment with a sponge, and just know that your discs, although they're not sponge, they're sponge-like. So I hope this helps.